Did you know that 1.3 million Ontarians don't have a family doctor? Elections or not, healthcare will always be an important conversation to have. If family health is an entry point to the healthcare system, what happens to those people who don't have a family doctor? I caught up with Dr. Tara Kieran about finding better ways to connect doctors to patients.
I'm Tara Kieran. I'm a family doctor at St. Michael's Hospital and also the Fidani Chair in Improvement and Innovation at the University of Toronto.
We've been through a global health emergency, but when we needed our family doctors the most, it seemed as if we had the least amount of access to them. How do you think the pandemic impacted healthcare in this province?
I think that the pandemic exposed the cracks in the system that we knew about to start. And of course, the area I think that was like most stark was in long-term care. I'd say the second piece, though, that it highlighted was also just the limits of the healthcare system. We saw that the association between, people and getting COVID, the people who were getting COVID, who were getting sick from COVID, that was really related so much to the social determinants of health. And I think it was a wake-up call for many people. Now, many people, it meant that we as a healthcare community recognized how important it was to engage with communities directly and with social services to meet people where they're at and start to address some of those social determinants, or at least prioritize services in those neighborhoods where people are more marginalized.
Roughly 4.6 million Canadians report not having a family doctor. Can you explain the importance of having a primary care physician?
So we know worldwide that health systems that have stronger primary care have better health outcomes, they have lower costs, and better health equity. And family medicine really is that front door into the healthcare system. We do everything from prevention to diagnosis of undifferentiated problems to treatment. We follow people all through their life course.
I want to go back to the amount of Canadians that don't have access to a primary care giver. Why is that? Do we know?
Yeah, it is a problem that 5 million Canadians don't have a family doctor. There are fewer medical students choosing family medicine as a career. And then even those who choose to train in family medicine, more and more of them are actually choosing not to work in an office-based setting where they do that kind of full comprehensive care. More and more of them are choosing to do more specialized care like sports medicine, work in an emergency department, palliative care. But I think when it comes to why aren't people choosing office-based family medicine, I think people feel like the reward for the work is not the same. In family medicine, you take your work home with you often. It can be tiring to be that front door and to be accountable all the time, as opposed to saying, okay, I'm just going to go in and see the patients at the hospital and then leave.
More family doctors shuttered their practices during the first 6 months of the pandemic than in previous years. And a recent survey of Toronto doctors has shown that 1 in 5 are actually thinking of closing up their business in the next 5 years. What does that mean for Ontarians?
It means that the family doctor shortage is only going to get worse unless we start to address it more seriously. And I think it speaks deeply to the burnout that many of my colleagues are facing, and saying it's a lot easier if I can go to work in a clinic where I don't have the same accountability that I might have in a family practice, the same paperwork, the same long hours. So I think it means that more patients are going to struggle to find a family doctor unless we start to address the problem in a more serious way.
What should governments be doing?
To start, we need to see expansion of team-based care in Ontario. So in Ontario, about 20-25% of the population has access to a family doctor who works in a team-based model. For example, in my practice, if you're my patient, you can see me, but you'll also sometimes see my nurse. Sometimes the pharmacist will be the one who's talking to you about your medications. I work with a social worker who can support my patients in crisis if needed, who actually helps to educate me about what services are available in the community. So I have someone I can go to help me to support my patients. Many of the high needs neighborhoods in Toronto or high needs neighborhoods kind of in the rural areas, including Northern Ontario, don't have the teams. One of the studies that we've done recently, we looked at patients of family doctors who were in team-based models compared to family doctors who weren't in team-based models. And what we saw is this trend towards, emergency department visits were actually going up for everyone during this time period, but they went up a lot less for people who were attached to a doctor who had a team.
Healthcare is one of the issues that's at the forefront of this election. What do you think our provincial government can do better, regardless of which party ends up being in power?
I'd say that some of the most obvious are strengthening our public health system, giving it the resources it really needs and deserves. I'd love to see us move in a direction where we are more neighborhood-based, where a network of family doctors are responsible for the care of people who live in a community, where just like you can sign up to be part of a school, or your kids attend a school when you move into a new neighborhood, hopefully, the family doctor network in your area would say, yeah, we take anybody who moves into this new neighborhood, so there wouldn't be that
the wait list,
the juggle that everyone is doing,
trying to find a doctor.
Yeah. So we need to really reform the healthcare system when it comes to primary care. There's some good things that have already been happening and some innovative models, but we need to really expand it and think differently.
That chat was part of The Thread, hosted by me. And if you want to see more videos, you can look here and here. Subscribe to our channel or follow us on Instagram at TVO The Thread. See you next time.